My name is Fraser Leversedge. I'm an orthopedic surgeon and have specialized training in hand, upper extremity, and microvascular surgery. I arrived here at Duke in 2009 after being in private practice in Denver, Colorado for about 8 years prior to coming. I think every patient comes with an individual condition, and too often we seem to pigeonhole a diagnosis and try to use a cookbook approach to taking care of medical problems, particularly when there's time constraints. I think the value in being a place like Duke is that we're able to really individualize a patient's care, where we can appreciate that there are many other factors. Even if it's a simple problem, there are time constraints for the patient. They want to get back to playing tennis or sports or get back to work. And all of these things demand some attention on our part to make sure that we address their individual concerns. And I think sitting down and helping a patient understand their particular condition, it allows them both to prevent it from occurring in the future, but also helps them to address and participate in their own care as they're being treated. I love coming to work every day because I take care of a diverse group of patients and diverse group of conditions, and that's for me the fun of hand surgery and orthopedic surgery. All of our patients want to get better. They want to get back to improved function and get back to an improved lifestyle. And being able to share that is what is a very rewarding experience for myself and for our team here at Duke.